We all know molecular testing is really important for lung cancer, and so in 2018, IASLC put together a survey to try to understand more how we're doing as a lung cancer community and what we're doing well, what we could improve on. And so last year, we sent the survey out to IASLC membership and anyone else that was interested in taking it. We had both identified and unidentified links to let anyone take the survey. We ended up with about 2,500 responses, a little over 2,500, so that was a good number of people that responded. And we asked some specific questions about molecular testing, and these are to provide healthcare providers. And we asked questions to the people that order the test, the providers that order the test, the providers that acquire the sample, and then the providers that analyze the sample, the pathology persons. So we found some interesting results. So we got those results analyzed this year, and we found that we're doing some things well. Some of the data looked as we would expect, so we felt good about that. A few barriers and a few issues we found that might be helpful to address. We found some dissatisfaction in general with healthcare providers about how molecular testing is going in their countries. And so I think that some issues that were brought up were cost of the tests and the time that it takes for the test to get back, and then some issues about the quality of the test still. So some specific reasons they may be dissatisfied. A good proportion of the medical oncology community cites they sometimes have issues interpreting the results they get back. And so we think this is really just indicative of how complex the situation is and how quickly things move. And so we think that there's some barrier there we could potentially address to figure out ways to help make these results more understandable, more standardized. Also, there are some concerns with some of the pathologists that more samples were inadequate than they prefer, and there weren't, we know that will sometimes happen, but there weren't policies in place to monitor and improve the quality in some countries, and so that's another thing that we could potentially address. But I think probably the number one issue that we need to move on first is 33% of the respondents were unaware of the most current guidelines for molecular testing. And so these are international guidelines that IASLC, AMP, and CAP put out, and we would like everyone to know about them and apply them in their practice. And so we have an opportunity to try to improve some education and awareness and maybe put some more structure around how we're handling molecular testing in our lung cancer community. It's really important because as we develop more and more new drugs, we need to find the patients who need these drugs and get the patients the best treatment possible, the state of the art, and so the testing is very important for that reason.